speak for themselves. The province is the country's epicenter of the coronavirus outbreak.
Is the most vulnerable province as a result of a number of factors. Firstly, we are a port of entry with regard to aviation, and we know that aviation has been a significant factor in the spread of coronavirus globally. Our province is also densely populated. We have the highest population in our country. 25% or 1 out of every 4 South Africans live in Gauteng. Our public transport system transports millions of people on a daily basis, and we also have densely populated human settlements. We have people who travel from across the country into our province on a daily basis, if not on a weekly basis. But we also have significant number of people from across our continent who come particularly into our province from the SADC region. And this makes our province, as I said, vulnerable.
So far, none of the province's patients have needed ventilation.
Most of the patients, they actually fit into the disease pattern that we have observed internationally, that 80% of the people who get infected, they have got mild symptoms, and they normally recover quite quickly. And then in the 20%, we get those who normally get severe thing. But maybe with the numbers going, touching wood, that we're not jinxing ourselves, we don't get to the point where we get critically ill patients.
With Gauteng being the most vulnerable, there are currently 249 traces, but the provincial government plans to bolster that capacity to 1,000. Strict protocols too, if you want to have a good time, with Metro Police called in to enforce.
They have been engaging all the tavern owners, and they've agreed that those that serve liquor, whether you are a shebeen or a tavern, they must make sure that they do not exceed the number of 50 patrons at a serving time.
Griselda Lewis, SABC News in Johannesburg.